Welcome everyone to this latest edition of EUCAYASNET webinars. EUCAYASNET is the short for the European Network of Youth Cancer Survivors, an amazing EU co-funded project that we are extremely proud to participate in. And I see that we already have 36 participants. Welcome everybody. We will ask you to please sign in and chat if you would like to. Say something, say where you are from, who you are, if you feel like it, anything about you that you think would be lovely for us to know. In this community, we expect not only young people with lived experience with cancer, but also researchers, healthcare providers, policymakers, or anyone from the general public, anyone at all who might be interested in EDI in cancer care. And that's actually a really good start and a good segue to asking you all, what does EDI mean for each of us? And any minute now, if you are joining from your laptop or from your desktop, you will see a prompt coming up, and you can give us your thought and input on Slido. If not, there will be a link in the chat where you can contribute. EDI for us stands for Equity, Diversity, and Inclusion. But what does equity, diversity, and inclusion in cancer care really mean for us? So we would love to hear from you. And as soon as, sorry, I'm going to just pop back for a second. And as soon as the Slido is available, you will be able to vote. I cannot see the Slido, so I'm going to be asking for Asta to let me know if it's already going or not, because I'm sharing my screen and I cannot see it. Could someone let me know from the panel, please? It does. Okay, amazing. Thank you so much. And I think I will have to stop sharing it in order for Asta to share with us the results. Is that correct? You can see the results. Okay, so in that case, I will have to just do something because I'm not, I don't see it, unfortunately. So I will have to do something. I will have to log in as well to Zoom so that I will be able to see it as a participant. But in the meanwhile, if we are ready, I'm just going to share with you the highlights of an event that we just held in Brussels in the European Parliament when we have launched the white paper, a policy paper on equity, diversity, and inclusion in cancer care. Today was a very big day for us in launching our recommendations here in the European Parliament. With young people with lived experience of cancer in the driving seat to create published recommendations for more equitable, inclusive, and diverse cancer care for Europe.
I did a scoping review and great literature review, and we saw that in Europe there are still missing a lot of points. regarding EDI. One of the main solutions is diversify not only the research, but also the research teams. Diversity is one of the teams to improve the EDI research. Just over 40% of young people actually don't feel represented by
Recording in progress.
provided to them in the healthcare settings. We need to do more. We need to implement EDI in policies and practices in healthcare settings as well as healthcare curricula.
There's the socioeconomic status, LGBT, race and ethnicity, all these factors that sometimes people think about in siloed and really need to start thinking about how they're interwoven together. And I think that's why it was so great to have a really diverse team in this project and to be able to work together internationally in an iterative way and really challenge each other to come out with a really fantastic.
I must say, being engaged in this project and working with young people, it was so enriching because you're real life confronted with the question they are confronted and with the barriers they're confronted with. And it reflects and gives you in-depth insight.
Being in Belgium, being in Brussels, being with the European Commission in the center, taking all this subject up front is the goal of everybody and give them tools and skills to spread the word and make people aware.
It really benefits institutions to look at this toolkit that we've worked on and try and integrate these perspectives, because not only will it lead to better science, but it will also lead to that science being more likely to be funded.
Thank you so much. This was really wonderful, and congratulations to everyone who participated in this. To everyone who was speaking in the European Parliament, and of course, for all the hard work that went into publishing the recommendations. And we will be speaking here today about these recommendations that were published and launched in the European Parliament. But before we move on, do you think I could ask for the second Slido question to be launched as well? And the question here is, if the audience on this Zoom meeting today think that the healthcare information, the booklets, the materials provided by healthcare institutions are representative and accessible enough for the diverse population of European cancer patients, we would really love to hear from everyone. No. Okay, thank you so much. This is quite an overwhelming, if I understand the statistics right. Thank you so much for Victor for sharing these with me. 63% said no, 32% somewhat, and only 5% said yes. Let's hear from some young people themselves. And before we do that, actually, let's just actually reflect on these highlights that we have received when we have done an online survey. 41% of young people living with and beyond cancer who have responded to the survey said they didn't feel represented by booklets or other information provided to them by the healthcare facilities. And the rest of these results are from them as well. Although 80% reported feeling confident in their medical team, 16% reported being exposed to racially charged or dehumanizing language during or after their cancer care. And more than half, 53% of young people with cancer think that policymakers don't do enough to address issues of EDI in their programs. And an interesting number as well, over 85% believe that there should be a clear EDI policy in the cancer care centers. And EDI education available for medical professionals. Now, we also have some young people here with us today who have undergone cancer treatment and have their own personal experience that they would love to share with us. And we are very, very appreciative, actually, that we are able to have such frank conversations and that you feel that it's a safe space to share your thoughts with us. So I would like to invite to the panel Levi Klubal from the Czech Republic, if I know correctly, who is a patient advocate. Carmen Monge-Montero, who is from Costa Rica, having lived in many, many European countries, more recently for many years in the Netherlands, who is a researcher and patient advocate for Youth Cancer Europe. And Erik Sturesson, who is also a patient advocate and our project's Discord community manager, and also working in Youth Cancer Europe. So I would really, really love to hear from you on what we just heard. I don't know if you feel like you would like to comment on any of these, or you would just like to share your experience with us. But may I start with you, Levi, having grown up in a Central Eastern European country, because I know there can be sensitivities about calling the Czech Republic or Hungary Eastern Europe. I'm Hungarian. But nonetheless, we're clearly not part of Northern Europe, not part of Southern Europe, not part of Western Europe. And I wonder if when you were in treatment, did you have any other thoughts other than concentrating on your treatment? And I know I'm privileged because I know a little bit about you and a little bit about your story.
Thank you. I had basically, I wasn't being like queer, didn't even cross the minds of the doctors, as far as I know. There wasn't any for, let's say, for trans people who want to undergo hormone treatment, there wasn't anything that would be educating how it works. But I think that that is mainly issue of being in a relatively conservative country. But yeah, like no actual information about queer people and how we should how we should navigate life further on.
And now that you are in follow-up care and you do go back to see your oncologists, do you feel like you might need to be the person that connects? Just if you feel comfortable telling us, are you on gender affirming therapy at the moment?
I do take hormones. Yes, I will not share anything further if you'll excuse that. But yes, and I have the privilege to say that I have most of my experiences were good. Almost all the doctors were like really professional and respectful. There were some that had rude remarks or strange requests. But I generally think from talking to other people who go to these doctors that generally they are somewhat respectful, or well, I say somewhat. They are respectful in a way that is acceptable. It could be better, of course, but it is currently okay, if I say so from my experience.
And do you need to be the person who shares information with your oncologist, or do you think that your oncologists were well prepared to provide for you care, or knowledgeable about the kind of care that they need to provide for you? or you needed to gather the information from other specialists and take it back to your oncologist?
I had to take a bunch of doctor's reports to my oncologist. He tried his best to figure it out with a therapist that was there, but majority of the work, I have to say that it was other specialists and me who gave the information.
So you really had to advocate for yourself in a way, and you had to be very knowledgeable about medical procedures as well, and medicines and drug interactions, because this is something that you needed to research and be aware of. Carmen, can I ask you about something? I know we talked at one time earlier, and you said something about information and how important it is to have information readily available. And you mentioned something that sometimes information actually didn't reach to you because maybe it wasn't presented in a language, or it wasn't reaching certain communities. May I ask you about these two things, actually? One is having information available so that you can navigate the healthcare system, and where do you get that information from, especially if you are part of a minoritized organization, or a subgroup. And another thing, maybe, as we said, is representation in written materials and in booklets and health information.
Yes, of course. Thank you for asking. Yes, I had this experience in many countries about the information that you can get from the healthcare system, because normally, like, the healthcare providers, they are used to people that was born there and live all their life there, so they know how the healthcare system works. But if you are a migrant, as I was in 6 different countries, it's quite difficult to understand how the system works in every country, especially if you don't speak the language in that country. Because normally the information that you can get is in the native language, and is okay, should be like that. Thank God that we have enough information. But it would be nice that also the healthcare providers, the hospitals, even like the government, acknowledge that there are other people that they don't speak the language and they need to use the healthcare system as the others. And there was some information that I didn't know. Even I live in a country for 6 years or 7 years. I didn't know until I met YC and EUCAYAS, and I get to know someone that was working in that topic in the country where I was living. So imagine, like, there are so many migrants in many different countries that they don't know what the healthcare system can offer, and all the accessibility and all the resources available for them. And the other thing was about the representation. And this is very important, because it's not only the information that you get to get treated, but it's also the booklet, the informations, the consent forms that has to be in your language, and also has to understand that you have a different culture. I had an experience where I had to do a medical procedure in the hospital, and I was not comfortable by having a male doctor doing that. So I asked for a female doctor. And they told me that that was impossible, that there were not female doctors doing that. So sorry. And I thought, like, okay, I can deal with this, but depends on everyone, right? Like, maybe there are other people that say, like, no, if it's not a female doctor, I won't be treated. And I think that is not fair, because everyone should be treated, and everyone, like, the healthcare system should understand that everyone is different.
You mentioned some very, very good points. What you said about asking for a female doctor might be important. Some of these things might be important for the queer community, and it might be also important for certain religions. And if our healthcare provision doesn't consider, as you said, migrants or minority languages or minority groups, subpopulations, or sexuality and gender identity in our here I'm talking about gender identity in our patients, then we can really fail them. And you pointed out how in some cases it might lead to someone dropping out of therapy or not actually accessing or have or benefiting from an available medical procedure because of these considerations that are for them very important. And if our healthcare systems are not allowing for them, then we are really failing them. I wanted to ask you something, Erik, as well. And thank you so much for being here. I really appreciate working with you because you were very, very open about your challenges from the minute that we met. And actually, I think it led to a very beautiful collaboration, and you are contributing in such huge ways to the work of Youth Cancer Europe, and you're a stellar patient advocate. If you are given the time and space, and I think this is what I would actually really like to ask you about, because you did mention that sometimes to digest information, we also really need to understand that some people have different learning styles or learning needs. Could you tell us a little bit about that?
Yeah, I mean, processing large amounts of information, for me, it's very difficult. And receiving instructions, for me, I really need it to be complete. I often look for what's not being said in instructions. So I need to have, the space to ask questions, and generally speaking, more time, but also, the environment to be calmer. So when I go to events, it's difficult to make adaptations in that way. But I mean, obviously in this community, it's being done quite successfully whenever possible, but making sure that there's not too much noise, not too much light, and being able to ask questions, it's extremely important.
Thank you so much, Erik. I know that within this project, we also undertook peer visits to many different hospitals across Europe. And one of the things that our researchers were also looking at was the built environment. And it comes to bathrooms and restrooms available for people as with the gender that they identify as. Worship places being available, written materials or signage or information being available in different languages. And also maybe later on we will speak a little bit more about having more diversity in the healthcare team. Because when you see someone who looks more like you, it gives you more confidence and it makes you feel safer. And also maybe allowing for rooms where you can feel calmer and quiet, not in the hubbub of everything. Or you also mentioned something, Erik, about people who might be prone to anxiety attacks, having that safe room, maybe not rooming together with 4 or 6 other people, because it might be very, very difficult to manage. And of course, we've noticed, there are some good initiatives where different healthcare providers maybe wear a tag or a sign so that LGBTQI plus people might feel more confident in approaching them or speaking with them, or if they speak different languages, that also really helps. All right, well, thank you so much. I wanted to ask, is there something else that maybe you feel that we didn't mention? That this is going to be a long webinar. We will talk about other things too. Levi, can I bring you back in again? Because I started.
Absolutely.
Is there anything that maybe you heard from the others that you can reflect on, or that you feel is particularly meaningful?
I really wanted to say that both of the other panelists and you, of course, it was really well said. I don't think I have anything to add. It was, I think very, very well said.
Thank you so much. Well, let's launch the next Slido question because we would really love to hear from everyone. And thank you so much for being here. Don't go anywhere because we might ask you to come back again if we will have answers at the end.
I think
Yes.
someone has a question.
Okay.
Yeah.
All right. Is this in the Q&A? I don't see a question in the Q&A box.
I think it's Evelyn Mantenhurst. Are healthcare providers well equipped to listen to your EDI question and anticipate on it? I don't know
The
what
questionnaire, healthcare providers. Yes, there was a questionnaire. Is this a question about a questionnaire?
Yeah,
Sorry.
I think I'm going to put it on the chat so you can read it.
Okay. Well equipped. So are they well equipped to listen to your EDI questions and anticipate on it? I don't know. We will be hearing from some healthcare providers later on, but let's circle back to this question. It's an excellent question and we can take it up again. Okay, thank you so much. I think we're ready for the next Slido to be launched. Have you ever been exposed to or witnessed any kind of discrimination in the healthcare setting? Yes, no, or not sure. Thank you so much for sharing the results with us. And I think we can also launch the second one. I mean, the next question. The next question is, do you agree with the following statement? All healthcare institutions should have a functioning EDI strategy and EDI education available for all medical professionals. Okay, well, that's quite an overwhelming, very big yes from everyone. So in the meanwhile, let me then share again. So I would like to invite to the stage Dr. Urška Košir. She is a scientific advisor for Youth Cancer Europe. She's a researcher and a YC patient advocate. And Carmen Monge-Montero again, who is a researcher and a patient advocate with Youth Cancer Europe. And let's start with this result that we know that we have received for the survey that was launched in this project, and maybe compare the results of our Zoom webinar participants with this. Carmen and Urška, the floor is yours.
Yeah, so I'll jump in. Thank you. And first, I want to thank all the patients, I mean, for just sharing your stories and being here. Having the patient perspective is so crucial to what we're doing specifically here today. And as Katie already has shown some insights from the survey that we've gathered, I think these highlights also speak for themselves. So briefly, we ran a survey that was deployed online One specifically for young people with lived experience, the results and highlights you've seen, and the second one for healthcare professionals. If you please just go back, we'll stick to the highlights. So we see the professionals that responded, 60 of them reported that they actually haven't heard about EDI policies and practices in place in their work environment. So they might have been aware of what EDI is, but they haven't come across it in their work setting. 90% of them, so a great majority, believe that it's the responsibility of the healthcare settings to provide support, both for patients and the healthcare professionals. And 80% of them believe that healthcare settings should create clear EDI policies. So that's a nice number, but we had an even better response rate in our question with 100% agreeing, which is great. To just rewind a little bit, like I said, we had 2 online surveys. The healthcare professionals that responded were 77 in number, on average 51 years old, from 22 different countries. And we saw quite a bit of diversity in terms of background. Majority did come from oncology training, but we did have nurses. We also had pediatricians. We had psychologists, social workers. So there was a bit of a range of views. And when it comes to young people, it was very encouraging to see that 128 people responded with an average age of 31 years and 19 a diagnosis. We had respondents from over 25 countries, which is quite great. And we really worked hard to translate the survey into 12 languages to make it more accessible. We heard language can be a barrier. We tried to overcome that. Hence, possibly also why the response was good. And we saw 58% of young people lived with multimorbidity. We know cancer is just one aspect. There's late effects. There's all sorts of other things that we face living on. And about 20% were still in active treatment and 80% off treatment. Again, an important thing to highlight, just to in fact showcase diversity in action. Because let me tell you, I'm trained in research, and early on, when I started working in this field, we really saw much less diversity in the samples. Yeah, and with that, I'll hand over to Carmen, who actually led the other part as well that informed the policy recommendations.
Thank you, Urška. Well, yes, apart from looking what the patients and the healthcare providers were saying at an European level, we also did a global literature review. This because we want to see what the European studies said about EDI, and also what the rest of the world is doing. So we can kind of learn from others, and from this get a more broad explanation or inspiration on our recommendation. So for this, we start identifying from the great literature 25 relevant sources, and we also did a scoping review of over 1,500 articles. We identified the main disparities in European cancer care.
Sorry, I don't mind interrupt you. I just want to say that in case we need to clarify it for all of us what great literature means. This might be, cancer charities or patient organizations, or maybe minority groups who might have had their own guidance or information in their own language for oncology care or cancer treatment. So great literature is not necessarily academic literature, but these are pamphlets and booklets and guidelines. And then the scoping review was for peer-reviewed and academic literature. And sorry, please go back and tell us about it, because it was a very huge number. 1,519 articles were analyzed. Go ahead.
Yes, of course. And yeah, the great literature also include reports. That is very important, like a report from everywhere. So yeah, from the scoping review, we identified the main disparities in European cancer care, common intersectionality combinations, and drew inspiration from valuable non-European studies for our recommendations. So from the relevant 45 sources that we include in the policy recommendations, we conclude that Europe has valuable data on EDI, but there is a pressing need for more research, particularly in standardizing data collection and monitoring EDI initiatives to test their efficiency and impact. Also, we have to engage a more diverse research team and healthcare providers. This is crucial to capturing the opinions and experiences of vulnerable populations. And lastly, there are still some disparities in cancer care that are not being studied, like gender identity, sexual orientation, ethnicity, migration status, neurodiversity. And this is globally, not only in Europe. And we have to understand the disparities because this could affect the detection and the treatment outcomes. So please, Urška, go ahead.
Thank you so much. This was really good. So there was obviously a lot of work that went into informing the recommendations. So the 2 online surveys, the literature review, workshops, the peer visits across Europe and many different hospitals. And then the end result is
the end result. So hopefully you all have either seen it or have access to this booklet, which is the product, the tangible thing that we can say this is what we do. And 3 very important things. And the first one you see written, spelled out on the top, it's community-led. So the greatest advantage, or rather than advantage, I think something that's first of a kind is that it's fully patient-led. We are young people with lived experience. We are bringing our expertise from navigating the healthcare and complexities of having lived with this illness, as well as research skills, writing skills, creative processes that we've learned through other means. Cancer is just one part of who we are. So it's really important to acknowledge that it's community-led, and I think this is important to highlight also to the healthcare professionals, because as we see these attempts to shift to patient-centric care, we need to then start recognizing and endorsing this kind of work. But nevertheless, it remained collaborative. We have gotten feedback from healthcare professionals and other stakeholders that are important to consider. We cannot do everything alone, nor should we. And at the end of the day, we try to be creative, thinking of what are we trying to do. It needs to be actionable. We want to act on it. If you go forward. Right, so there's 3 overarching themes. Carmen already nicely set the stage for me. We began by research and we ended by research. Of course, it's evidence-based, but our recommendations kind of propose that EDI needs to touch upon these 3 aspects first and foremost. So one is research, the other one is cancer services, and the third one is patient organizations. And I'll begin by research. It's really important that when we talk about research, again, Carmen, thank you for highlighting this. I cannot stress enough, when we do research, we need to try to improve it systematically and systemically. We need better data. And again, speaking from my own experience, we sometimes just don't have questionnaires that are even able to capture the diversity we want to see. Sometimes that's due to legal constraints. Sometimes it's just poor methodological design. So again, patients sitting at the panels or in group settings or research teams that can inform the development of new research are key to make this future research more diverse. We also need to agree then on standards, because what we want to do is to be able to to compare such new data across Europe for better care for everybody. And most importantly, we need more diversity in research teams themselves. So the next thing is cancer services. Again, similar thing. We want to be providing culturally sensitive care, but one way to make sure that happens is by diversifying the care teams as well. We need better representation. And then when we speak about policy, which is the topic of today, we need to start co-creating policies. Still, sometimes even with these patient-centric approaches, we still end up being very top-down. What we're doing here today is co-creating the future policies. And lastly, EDI pertains to patient organizations like us in YC as well. So in going forward, we need to really make it a point to have a proactive approach. We're trying hard to recruit from diverse backgrounds. We're training ourselves and others on cultural competencies when trying, again, to promote policies and practices that have inclusivity and equity at heart. So it's a rolling wheel. It's a forward feedback loop, which is going to keep on building as we bring in more people with experiences like ours in. We're more likely to make it more approachable and accessible to other people from diverse backgrounds. So back to you, Carmen.
Thank you. Well, apart from the main recommendations that was saying Urška, we also developed 26 target actions, and these are going to be more targeted to the main 4 disparity that we found on our research. So as you can see in the table, these actions are grouped under 4 focus areas according to the recommendations. These are race and ethnicity, culture, refugees and migrants, gender identity and sexual orientation, age, physical and mental well-being. This is going to include also neurodiversity and disabilities. And lastly, education, career, and socioeconomic status. The actions extend across the 4 focus areas are not mutually exclusive. What does this mean? Like if you go to the next one, it will mean that this setup is particularly effective for addressing intersectionality, tackling issues that affect people in different and overlapping ways, and ensuring we address everyone's needs. So as you can see, these are the actions in different type of groups, but they can also be applied in the other patient organization, cancer services, and research. So it's a very cool table. I hope that you check it out, because it's very complete in the way that if you don't know what to do, you just see the table, like what you want to tackle, and then this action can be implemented in other areas as well. So back to you, Urška. Oh, Katie, sorry.
Well, yes. Right. So I think what we would like here, and I cannot see if this has actually been put in the chat, but it would be lovely to actually have the link to the white paper itself for everyone to be able to look it up, and it is also going to be here. So if you go to beatcancer.eu resources, you will be able to see the recommendations for equitable, diverse, and inclusive cancer care in Europe. The very paper that was launched in the European Parliament about a month ago. Okay.
Sorry, Katie, just before
yes.
we jump on to the next speakers,
Yes.
I think we just I want to turn back to the Slido question, which is the only one I don't think we directly address, which is if people have been exposed to discrimination.
Yes,
In the very early on, you said 16% of young
So
people
it
have.
was 63% of young people, is this the one?
So from our survey, we have seen about 16 or 18% have experienced it, but here in our audience, we saw 60%, over 60% have witnessed or experienced discrimination or some form of inappropriate behavior. And I will tell you to myself, I had to think hard, and I don't know what, or back in the day, I wouldn't have known what counts as inappropriate, because you're worried about just getting the care you need. But then all of that really impacts how you're progressing through and can really impact psychosocial well-being post the active treatment as well. So I just want to say it's a concerning number and something we're trying to address with our work. So I just wanted to acknowledge that we took note of that, and yeah, thank you for sharing. And any one person experiencing it is one too many. So yeah, thank you.
Yes. So what I'm seeing here was that 65% said that yes, they have witnessed it, or
which nicely supports our proposal to also work on EDI policies in the healthcare settings, healthcare professionals. Maybe they don't do it intentionally, they just don't know. They aren't adequately trained. Again, going back to the diversity, if their colleagues would have been more diverse, maybe they would already learn throughout med school or in training. It might not always be intentional, but people sometimes just don't know, which is why we need such trainings and policies and
yes,
practices in
we all
place.
need it. I really look forward to participating in the training, because I really feel inadequate a lot of times. And I think it's a genuine worry that we make mistakes and we misspeak. But can I ask something? And I'm very happy to bring in the other panelists as well, because it's really good to have a good patient representation here next to Carmen and Urška. Also bring back Erik and Levi and ask, what do you make of the number? We had 24% of people on this webinar saying they are not sure. So 65% said yes, they've been either exposed or witnessed it. 24% said they are not sure if they have.
I think that the people who said not sure, because it's difficult to define what would be inappropriate behavior, mainly when we're talking about youth cancer survivors. So it's sometimes things are only obvious in retrospect. And for example, from my experience, some things that have happened to me, I only through years of therapy figured out that they weren't okay. So I think that the not sure people may not have fully realized what is and isn't okay to treat a person.
Yeah. Sorry. I think that a lot of times, we look to ourselves and find, that we're the ones who are doing it wrong or that are incorrect, because we're being told, it's not normal. How to deal with panic attacks has been an issue for me when I've been doing surgeries. When I've asked for help with that, like, how will I handle the panic attacks after, the surgery, having to spend time in the hospital? And then they're like, I don't know. They wouldn't do any adaptations at all. So yeah, it's a problem.
I think it's also very cultural in the way that they teach you to be a good patient, like do not complain or do not say what you're saying, doing wrong or something like that. So that depends on the person as well, and where do they grow up, and the vision that they have about the doctors and the healthcare system and everything, that maybe they're afraid to say, yeah, this was not right, but I don't want to say anything. So it could be. one of the options why people is not sure as well.
And it brings us back to the question about representation in the materials that were provided also. As we continue working on this topic, I think all of this will improve. And once you are more exposed to diverse materials or materials that acknowledge diverse needs, then people working with patients might be more likely to notice some things or be more open to discuss other things. So it's really a feedback loop. So that's, we just gotta
As long as we are
target
in
more.
motion, hopefully
Yes,
we're
exactly.
going to be going forward and not backwards. Yes, thank you so much. Really, really a good contribution. And I would like to invite to the stage now Johan de Munter, who is the nurse manager of the Cancer Center in the University Hospital of Ghent. And he's also a past president of the European Network of Cancer Nursing, EONS, a long-time collaborators with Youth Cancer Europe. We really appreciate you being here. And Diana Todea, she is working in a clinical setting in a large oncology center in Transylvania, Romania. She is a psychotherapist, and I'm very proud to say that she is one of our colleagues in Little People Romania. It's lovely to have you both on this panel. You've heard from the mouth of patients. You've heard about some of the challenges. You've heard about some of the wishes and desires. You've seen the survey results and the results of the literature review. May I bring you in to speak to us a little bit about implementation and, you know, what might be the impact of the work that is being done right now in this project, if any?
Thank you very much, Katie, and thank you very much all for inviting us here. I think, first of all, to say, with all what we heard already, a little bit feeling embarrassed as a healthcare professional because, yeah, what is told and what we are sometimes not aware of, that is very important to acknowledge that. And when we see the results, like even 60% never heard about anything about EDI policies or practices, that says something what we need to do. And I think, first of all, is starting with education or healthcare professionals. And with that, I want to answer already a little bit on the question that Evelyn asked us, like on the healthcare professionals, are they well equipped to listen to EDI questions and anticipate on it? And I don't think so, not at all at sometimes. And education will be key. And as I need to acknowledge in my own education pathway, EDI was very, very little on board. So I think for healthcare professionals, there's a huge challenge there to incorporate a training on EDI. And answering your question, this work will be massively important for this to create that awareness, but also bring everything that is documented now into the education, and looking forward with working together with young people with lived experience to bring them in the education to healthcare professionals. And I think for healthcare professionals, it will be important to have that education with different healthcare professionals, nurses, physicians, psychologists, physiotherapists, all together, because we work together. And this is really a topic we should train together, because this is like an interdisciplinary approach as needed to address this for healthcare professionals. So there is work to do there, and I'm fully commit me to that.
Thank you so much. And I mean, we do see a lot of very good initiatives in Belgium and in the Netherlands and many other countries as well. You know, we had a Discord meeting, not a webinar, but a community evening a few nights ago. And I know that one of our community members, Stuart, shared that sometimes we really look to the UK as a leader in EDI practices and some good policies. But actually, there are some very worrying, reverting trends right now that really hurt some minoritized populations in the UK. But we have seen some of the Western European countries as, I don't know if we should call them trendsetters, but at least some examples of how implementation might look like. And I really appreciate also the comment from Evelina from the Netherlands and from the Dutch EUCAYA network, the Adolescent and Young Adult Care Network. So these are really good initiatives. But I think it's also very important and healthy for us to look a little bit more towards Eastern Europe and Southern Europe and see what's happening there. And this is why I'm also very happy to have Diana on the team here. And Diana, you were also there in Romania when we had a large workshop thinking about the needs of a possible EDI toolkit and what EDI education for healthcare providers might look like.
Yes, as a psychologist, I am aware of the impact of the discrimination can have of the mental and emotional well-being of the individual seeking healthcare, especially in the context of cancer care. I know, and I'm working from like 10 years on the oncopediatric care, and I know that maybe the people in healthcare might have unfair opinions about others, which can affect how they are treated, especially if they belong to minority groups. And I can see this all day long. Another problem in the healthcare systems, I think, is the lack of diversity in leadership. And there might not be enough different kinds of people in charge of making these decisions in the hospital. So I think it might be really important also to do something there. But I also think that the healthcare services and the people that are working in the healthcare services needs to learn how to communicate with minorities. So maybe we can also do something on that. And what I saw also in the hospital is the fact that some people might not want things to change because they think that it's not important or it might make things worse. So I think that we also need to make sure that we will take care of this and will help the healthcare people to understand that maybe it's good to learn something new and to make sure that we are taking care of the minority.
Thank you so much. I'm so thankful for your very honest comments from both of you, because I think you are giving us a very realistic picture, a picture that's not hopeless. I think there is lots of hope, but it's also very realistic because we need to understand what our starting point is. And I do remember this was a conversation actually in Romania, that we need to create educational material that our healthcare professionals will buy into. And create it together with them. So in Romania, we also invited healthcare professionals to participate. And I know that there are healthcare professionals on this webinar participating right now because I've seen some names. So there are some healthcare professionals, oncologists from Croatia, epidemiologists, oncologists from Hungary. So you're really welcome to use chat or the Q&A box in the Zoom to maybe ask questions or let us know or share your opinion, because we really need to work together with you. And I think that we were really trying to make sure that the toolkit that we are building is built together with healthcare professionals, with patients, obviously. So the toolkit itself is going to be also addressing these different populations, but we wanted to make sure that we are realistic and we really come up with actionable and implementable suggestions and educational modules do you think that, for example, in EONS, in the European Nursing Society, Oncology Nursing Society, there will be an uptake of these initiatives? Like, do you foresee this? And I'm not asking you because you know, you're not the one that we can hold responsible. You're not currently a president, or so I don't mean it in that way. Like we're not holding you accountable, but I'm just asking, like, how do you see the European landscape? Do you think that oncology societies will take on these recommendations or benefit from the training that we would like to put together and we will be piloting soon?
I think so. I think they are very important, as the co-creation of these recommendations was very important. I think the co-creation in creating that awareness will be also very important. And I'm sure that oncology organizations like EONS, European Oncology Nursing Society, are willing to take this up. Because one of the things is that also, for example, if you want to lobby, we need to do it on different levels. We do it in clinics by ourselves to increase this, but also on the policy level. So I think there is a huge challenge there also to put this on the European level and incorporate this, for example, in EONS. We definitely will going to be willing, and it's already included in, for example, the education framework for cancer nurses across Europe, to include these recommendations. So that will disseminate over all the member states, so they can implement oncology training and incorporate these recommendations. So that is what we want to work for, because that's why we do it, and there is a need to do this to support our healthcare professionals across Europe. And I'm sure that other organizations also will adapt this, because this is great work in co-creation, and it reflects the real life, and it also supports us to be that better healthcare professionals and help everybody that is coming in touch with healthcare. And the only thing to do it is by working together. So yes, you have my commitment.
And again, I'm really sorry, and I hope that I'm not saying this the wrong way. And again, I'm not holding you accountable, Diana.
I know.
Just saying that neither you, Johan, neither Diana, but I know that the Romanian Society of Pediatric Oncology is going to be meeting in June, for example. Do you think that this is something that can be brought to the, as we say, the Söröhope meeting, the Romanian Oncology Society meeting? Is this something that you have hopes that it can be done, or you're not confident that we can infiltrate?
In the hospital where I work, I know that the medical staff really want to understand the needs of different groups and how to help them. So I think it's a good start, because we know from one hospital that the answer will be yes. And I will say yes. I will say that yes, I think it's possible.
Okay, good. Again, you're not accountable, but we've heard it and it's recorded. So thank you so much for that. I think it gives us a lot to think about, and for patient advocates and for professionals advocating and participating in creating educational frameworks for healthcare providers. There is something really serious to think about in how to incorporate these recommendations. Then, but thank you so much. It was amazingly important to hear from you. Thank you for your contribution. And this is a really good segue, I think, to then now reveal what's going to go into that very famous, sorry, let me see if I can, EDI training that we keep referring to. So without further ado, I would like to invite Dr. Emily Pattinson to the stage, and I would like to ask them to please tell us a little bit about the upcoming EDI training opportunities and the resources that will be available for researchers, for patient communities, and for healthcare providers. Welcome, Emily. The floor is yours.
Thank you very much, Katie. Thank you everyone for having me. My name is Emily Pattinson, and I am a senior inclusion consultant with Inclusive Employers. So we are an organisation that are lucky enough to be supporting and working directly with Youth Cancer Europe to develop this amazing training programme that's going to be launched in the coming months. So as we've said, many people have said throughout, this was developed in collaboration with many different people, including some faces I recognise on the call. So it was really important to us that this training programme wasn't something that just kind of gave people a load of facts and then sent them on their way. It's important that it has practical applications, that people are able to take away this learning and implement it into their organizations, into their role, into the way that they care for their patients. So on the screen, you can see some of the key objectives and some of the expected outcomes that we're going to ensure that anyone who attends is able to take away. So we're going to make sure that we're broadening that understanding. So we're introducing a lot of different inclusion topics and cultural awareness topics to and how they relate directly to the quality of cancer care that people receive. So we're broadening that understanding, not only for people personally, but also their ability to explain that importance to their colleagues and their patients. We're then going to try and increase that confidence to have those discussions, because a lot of the time people aren't getting involved in inclusion conversations and pushing this inclusion development forward, not because they don't want to or because they don't think it's important, but because they just lack that confidence. People are often worried about saying the wrong thing, so choose not to say anything. And that is totally understandable. So what we're going to do is try and raise that confidence so that people feel when they go back into their institutions that they can have those discussions. Doesn't mean they're going to be an expert in everything, but it means they're going to have the confidence to manage those conversations a little bit better. And that is largely because they're going to have a much deeper understanding of their personal and organizational role in this inclusion development, because we all play a little role in developing inclusion, and it is very much like getting that ball rolling, that we all play that little role, but everyone doing a little bit becomes a big change. So we're going to do a lot of work around understanding things that we can impact personally, things that we can do from an organizational perspective, and how they work together to really develop cancer care. And we're then going to work with people on a personal level to understand their own learning needs, their own allyship journey. Where are they right now? Where do they want to be? And how are they going to get there? So we're going to be working with people to help them develop their own personal development plan. And they're upskilling them to be able to do the same thing for others. So allyship is something that's really important. You don't need to be a person with lived experience to be fighting a cause, to be pushing an agenda, to be really making a difference. But you do need to understand where you sit, where your spheres of influence are, and how you can make a meaningful difference. So we're going to do a lot of work around that. And then also understanding how you can support others to do that as well. So we go on to the next slide. So the structure of these sessions, there was a lot of discussion in our co-production workshops about what this is going to look like. And with a lot of guidance and support from absolutely incredible contributors, this is what we have come up with. So we have core sessions, and then we have specialist sessions. So the two topics that came out as things that everybody across the board wanted to learn more about was understanding inequality and cultural awareness and how that directly relates to cancer care. So that's going to be looking at some of the big topics, looking at different inequalities, looking at different characteristics and groups and how that impacts their cancer care, and then starting to address some of this cultural awareness skills. So that's that first session. We're starting big on some of the big topics. The second session is going to look directly at language and communication. So this was the most mentioned topic consistently across all groups, was language and communication. So what we're going to look at in this session is not just how we communicate or what we say. We're going to look at different communication styles. We're going to look at that in terms of how that relates to language, translation, but also neurodiversity, disability, age, and how all of those different aspects might adapt the way that we communicate to ensure we're increasing that quality of care. We're then also going to look at some of the challenges that Carmen mentioned earlier around kind of what we have, how we can ensure that quality of care when someone is not necessarily speaking the language that the care is normally delivered in, and how we can ensure that we are offering suitable translations when sometimes certain words don't directly translate. And so we're going to explore all those kind of topics as well, and how we can build those skills, because it's not necessarily about knowing what's right and what's wrong. It's about having the confidence to have those conversations about what language do you like? How do you prefer to be referred to? And so we're going to be building all of those kind of skills in that session. The third session, that has been specialized because that's going to look at the individual's role. So that is different for healthcare providers, for researchers, and for patient advocates. So with healthcare providers, we're going to be looking at the healthcare provider's role. We're going to be exploring patient-centered care versus practitioner-centered care, and how that might change the inclusivity and experience of cancer care. We're going to be exploring patient autonomy and all of those different topics to understand how we can best negotiate and provide inclusive cancer care for young people, support parents and families in that situation. So that's going to be the crux of that session. For the researchers, we're going to be looking at the research life cycle. So we're going to be exploring all of the different steps in research programs, and how inclusivity can be embedded effectively in each of those sections. We're going to explore research that's been done particularly well, research that's missed some opportunities and could have been even stronger. And then we're going to do some activities around their own personal research experience and research projects, whether they're current or future projects, and how they can embed inclusion into different parts of that. For the patient advocates, we're again going to be looking at the role of patient advocacy, where that extends to, where their spheres of influence are. And then we're going to start to look and build skills around identifying stakeholders, negotiating with stakeholders in a productive and positive way, and starting to be able to raise the voices of patients in a way that is going to be heard and received and listened to. So we're going to look a lot around influencing skills and all of those kind of really vital skills for patient advocates. And then finally, the fourth session is going to bring all of that learning together and look at how do we then take that back into the organization? How do we take all this learning and translate it back, make sure people understand, make sure people feel excited about this? So we're not expecting those attendees to be able to go back and deliver the sessions straight away or teach people everything that they've learned. That's just not realistic or fair. We're going to give them the skills to be able to encourage people to start their inclusion learning journey, to be able to signpost people, to be able to answer those sort of frequently asked questions. And then we're going to build some of those skills to be able to stay connected and support each other. And all of this will be underpinned with a workbook that has self-directed learning throughout it. So there's different activities to allow you to take the things that they've learned in these sessions and apply them to actual situations and scenarios. Because it's all well and good knowing the theory, but you need to know how to put it into practice. So that companion workbook is going to go alongside the training as it's delivered, but also be almost a resource that can be referred back to as they implement the training, as they want to keep reminding themselves as they go along. That's all there to keep to refer back to.
Thank you so much. It's incredible, by the way. I just want to note that, I mean, who doesn't want to participate in this? Isn't it? Like it's just so amazing and so much. I mean, the promise also of working with every single participant to look at their own allyship journey and their process and what's next and their plan. I mean, I'm there. I'm actually going to be participating. I'm coming, but you know, don't forget to sign up. And I think there will be more about that later. But just thank you so much, Emily. It's already really looking very good, very well. We have about 3 more minutes for you, if that's sufficient.
That's fine.
Okay.
So I'll wrap up then. So yeah, you can see on the screen, I've kind of gone through most of these anyway, but those unique opportunities are going to be getting a wide range of perspectives from that pan-European perspective as well. So like we said, we're addressing this idea that a lot of this content in the past has come from a UK or a US perspective, but we're making sure this has come from a pan-European perspective. So it's going to be relevant. It's going to be relevant examples. It's going to provide a safe space for people to learn and practice and get things wrong, because that's part of learning. And it's going to develop that strong support base. You're going to be a team. You're going to meet people. You're going to develop those networks to allow you to take that learning back into your organization. And there will be opportunities for ongoing support from the team itself to be able to keep checking in and make sure you have all those skills and information to take the learning back into your organization. So I will hand over to Victor, who's going to tell you exactly how to get involved.
Thank you.
Thank you,
Victor,
Emily.
thank you so much. And just one word about Victor, that he's been leading this work stream in the EUCAYASNET, or the European Network of Youth Cancer Survivors EU co-funded project. And thank you so much. And also he was responsible for pulling together the bits and pieces of this webinar. So Victor, tell us about it, because you know, I expect everyone wants to register right now.
Yes, thank you for your words. Of course, I have an amazing team that I cannot do this without them. But the training, yes, you can see the link in the chat. You can click easily on that and register. You could also scan this QR code for those that are in the webinar using their laptops or computers. Or you can just go to beatcancer.eu/events and you will see it down there. So this training, yes, it's for everyone who works in oncology in a hospital, as a researcher, as a healthcare provider, as a healthcare professional, whether you are maybe a patient advocate in a patient organization, or
you wear many hats. You
yes.
wear 2 hats at the same time.
You can apply for 2 or all 3 of them, and come to the training. Maybe you have experience living with and beyond cancer or not. Anyways, you're welcome to register for this event. So the first one will be from June 3rd to June 6th for researcher group. Second one will be the healthcare professional group from June 6 to June 9. And of course, the last one will be for patient advocates, patient organizations for June 9 to June 12. The travel and accommodation is included. All you have to do is register at the link in the chat.
Thank you so much.
Thank you.
Amazing offering, stellar work, as Emily said, in co-creation with all the people who have participated in the workshop, contributed then with their voice and thoughts, and then have been contributing since. And a massive thank you to Inclusive Employers for their work done so far.
Katie, I'm sorry.
Yes.
Register until May 5th. I would say register today, but if you cannot register today, please register until May 5th. So May 5th is the deadline.
And please do send it around to your colleagues as well, because you might be on this webinar or you might have seen the announcement for it, but maybe other people in your institution, in your research institution or your research organization, or in your academic institution or your cancer center might not have seen it. So please do share it widely. We would love to, we would love as many people to benefit from it as possible, because we think that this is really an amazing offering. And before we let you all go, we just wanted to say that this amazing project that helped us to focus on things that we love and allowed us to make headway in areas that we felt we really needed to work on as Youth Cancer Europe as well, and many other patient communities across Europe, is going to be coming to the end in August. The European Network of Youth Cancer Survivors EU co-funded project is ends on the 30th of August, but not without a big bang in the beginning of August. So we are expecting people to register. In fact, I believe today is the last day to register. Today is the last day to register for the biggest meeting of European Youth Cancer Survivors, for the closing event of the European Network of Youth Cancer Survivors project. And everyone who participates gets a freebie, a full pass to the full access of all the days of the Untold Music Festival, and benefits from workshops on adolescent and young adult care, quality of life in cancer care, EDI, and some other very, very exciting workshops that are all going to be coming out of this EU co-funded project. So sign up today, and literally today, because we are closing registrations. So it was lovely to have everyone here. I'm going to stop sharing so that I can see if there are any open questions. I don't see any in the Q&A box. Are there any? There's lots of promises and commitments. Thank you so much. Amazing. Thank you so much, Dr. Jakab Zsuzsi from Hungary. Thank you. Thank you for the contribution from Northern Ireland, from Croatia, from the Dutch AYA Care Network, Adolescent and Young Adult Care Network, and from Kosovo as well. Thank you, everyone. Are there any burning questions for any of our panelists today? If not, I would like to ask if maybe Asta, and we would like to say thank you to Asta as well from Pola, who so generously hosted this webinar and has worked out all the logistics and the technical aspects. Maybe if you don't mind to sharing, to share again the word cloud from the beginning of the webinar, the one that I missed when we asked, what does EDI mean for you? Or if it's not possible, then everyone is very welcome to leave a comment in the chat, and we will make sure that we will be good guardians of the contributions and everything that you provide, and we will make sure to incorporate all of your feedback and comments into the work that we are still doing and working on, and the workshop that's going to be coming up. Thank you. Being respectfully treated. equality of opportunities, equality of care, respect. Very nice. Very, very good. Feeling welcome, feeling heard and supported, the right attitude. I think a lot of these words actually underline how important it was to plan the EDI training in such a way to focus so much on communication, because that is going to be a key for all of us. Compassion, very nice as well. Thank you. Well, thank you so, so much, everyone. Any last words from any of our panelists? Please feel free to all unmute yourselves and share whatever you feel that might be worth sharing.
I would say let's continue work together and make it an equitable, diverse, and inclusive world for everybody. So thank you.
Thank you as well. Thank you. All right. Well, then I think this is it. Thank you so, so much for everyone's contribution and patience, and for being with us on this evening. I know that tomorrow is bank holiday for most people. I mean, a free day for most people across Europe. So if that's the case, I wish you all good weather, an amazing day off with loved ones, family, friends, respite from work. And for those of you who will be working, then good job and good work. And we will see you again very, very soon, hopefully with a lot more registrations coming up soon to the EDI training event that's going to take place in Romania in June. And if not there, then at the August closing event of the European Network of Youth Cancer Survivors next to the Untold Festival. Don't forget to register, because registrations are closing soon. Thank you so, so much, everyone.